Hi, I'm Tyson Franklin, and welcome to this week's episode of It's No Secret Dr. T. With me today is Dr. Arianne Missimer. And Arianne is an award-winning doctor of physical therapy and registered dietitian. She is also an athlete, and she has been on American Ninja Warrior. She is a bit of a champion. We met in October last year at Business Black Ops, and I'm so happy to have her on today's episode. So, Arianne, how are you doing today?
I'm great. Thank you so much for having me.
You have done so much in such a short period of time. When I read through your profile, I went, hang on, this person that's coming on must be 100, and and you're not.
I'm not. Well, I've been busy over the years.
It's been incredible. So we met last year, October in Arizona, and I remember before you arrived, I think Dave Freeze said to me, "Oh, we've got because I always say, is there anyone new coming along this year?" Because I think last year was my 5th year that I'd gone to it. And I said, was there any newbies? And he goes, well, I've got an American Ninja Warrior coming along. And I went, oh, okay. And I'm expecting this beast to just turn up. And then you turned up and I was introduced to you. And then what didn't click to me, and I knew you were fit.
Right. And you thought I was 100, so.
And I thought you were 100 because I heard other things about you as well. And and you weren't. So where did this all start? So you're a doctor of physical therapy.
Mm-hmm. So I started my career in fitness, actually. So I started when I was 18 doing personal training, and I went to school for dietetics. So when I finished school, I finished with I completed my RD exam, and then I opened up my first personal training studio at 22.
Okay, so you started with your own gym, started in fitness.
Yep.
When did it move into do you call it physiotherapy in America or physical therapy?
Call it physical therapy.
Okay.
So when I first actually opened up my personal training studio, at the same time my brother had passed away, and I actually, when he was in hospice, was his physical therapist. So he had lost function of his arm and leg, mainly due because he had tumors, metastases in the brain. And I would come home every day and I was moving his arm and leg, and we'd go for a walk. I'd kind of walk him in the wheelchair. And so that was part of it. And then while I was working in a fitness setting, I realized that everyone was coming to a fitness setting with pain and injury.
Yeah.
So that was really what kind of kickstarted my pursuit of PT school. So I did that about 4 years later. And then from there, decided to work in a outpatient PT practice. I did that for 8 years while I was running my business. So it was a little bit crazy.
Oh, so you didn't give up the business. You kept the business while you did your study.
I did. And mainly because my goal, which is kind of, I'm sure what we'll get to, was to really open up a multidisciplinary practice. And I wanted to really combine all of these aspects of wellness. So not just the preventative side, but also the rehabilitative side of things.
But then you've gone on from that and gone and got a PhD.
So, well, I had my clinical doctorate in physical therapy. Mm-hmm.
So how much longer did that take afterwards to complete that?
So that was 3 years. And then, like I said, then I kind of worked in a PT practice after that.
Okay, so this is adding to the 100 years that I was talking about.
This is adding to the 100 years.
Yeah, and then you became a registered dietitian.
So I became a registered dietitian first.
Oh, that okay.
Right out of school, right out of undergraduate. I did that. And then I went back to grad school for my doctorate. Okay,
look, I'm adding all these years together so people can picture I'm talking to this little old woman with a walking stick.
A 100-year-old beast.
So with the American Ninja Warrior, what made you decide that? Well, you mentioned your brother and that he had cancer, but you had cancer yourself.
Yes. So this was 4.5 years ago.
Yeah.
I was actually getting ready to get married. So it was 2 months before my wedding. I was diagnosed with stage 3 liposarcoma, which is very rare and aggressive cancer. There's only 12,000 cases of sarcoma a year. And I soon kind of came up with the motto, challenge accepted. My boss at the time had given me these bracelets my husband at our wedding gave them to all of our family and friends. And so through that, my treatment, which was chemo, radiation, more chemo, surgery, I decided that I was thinking about American Ninja Warrior because my husband had introduced me to the show when we were dating. And he said, Arianne, I think you should be on that show. And I had never seen it. And I thought, that's pretty awesome. I said, you know what? One day I'm going to. So it just so happened that I was in cancer treatment when there was this gym that opened up. It was a local ninja gym. So I decided to go one day after radiation treatment. And
because that's what most cancer patients do. Yeah, after radiation, they go, I might just go and hit the ninja gym.
That's exactly right. So I went in, and the Mark, the Falcone was the owner. He's amazing. And I walked in and with my bald head, and I said, hi, I'm Arianne. I said, I'd really like to train for American Ninja Warrior. And he said, okay, I said, that'd be great. And I said, I have a few things going on. I said, I'm currently doing radiation. I still have to get surgery and do chemo again. So I said, I have to work around some things, but I'd really like to do it. So he said, awesome. He said, let's start Tuesday. So I went every week. I'd go to I'd work in the morning, go to radiation, take the train to Philly, back and forth, and then go there and work out for a couple hours.
Do you think his positivity basically helped? Like, obviously, you've obviously always had a very good mindset yourself. Set yourself goals. You achieved a lot right up until this point.
Right.
Do you think going in there, him being positive and not looking at you going, oh, okay, you're a bald-headed cancer victim, I don't know if you should be doing this, and then sort of talking down to you. Instead, he was talking in a positive manner, had a good mindset, and said, yes, if that's what you want to do, let's do it. That actually helped?
Absolutely. I always say to him, I'm forever grateful because you're absolutely right. When I went in and I said that this is what I want to do, he said that, there was no barriers in his mind, and nor were there for me. So I'd go in and train with him, and we'd kind of work through all the obstacles. Obviously there was a lot of things that were challenging because I had a port in my chest, and I had a ton of swelling in my leg where I had the tumor. So, there was definitely things I had to manage, but he was amazing. And yes, I always say I'm forever grateful to him.
So how long did it take before the treatment with the cancer was over, that then you could really start ramping up the training at the gym?
It was about 9 months, kind of in total. And what had happened was I trained really all throughout it, but I had to, obviously when I had surgery, I had to stop for 6 weeks and, things like that. But the last day of my chemotherapy, which was also the last day of my cancer journey, I was in the hospital, so I had to do inpatient chemo, and that was the day that I submitted my application. So I was sitting there and I looked over at my husband and I said, hey, I just submitted my application for American Ninja Warrior. He's like, you're crazy. And as I, of course, felt pretty awful at the time. And then in that January, I had to kind of ease in because I wasn't feeling great for a little while. But I really just kind of ramped it up. And then May of 2016, about 3 weeks before the event, they called me and said that I was accepted.
What was the selection process? Did they just look at photographs of you? Did you have to submit videos to say, hey, look at me, I can do 500 push-ups with my husband sitting on my back? Yeah, were there certain things they told you, we need to see videos of you doing this to make sure you're not just going to crash and burn at the first hurdle?
Exactly. So you have to do it's about an 8-page application where they're really just asking everything about your life. And then you do a video submission, which is really the most important part. And it's really to show your personality, your story, and your physical ability.
Okay. Do you think part of your story was what intrigued them, that you work with the cancer? Because I'm sure they look at the background, and if your background had been, former axe murderer, they'd probably go, yeah, no, but you're really fit. You can really wield that axe. But not really what we want on a family show during prime time. And here's Arianne, axe murderer. Good if you want to be in the UFC.
I don't think I would have been accepted.
Yeah, if you want to be a cage fighter, it's probably be fantastic, but not for American Ninja Warrior.
Right. So the story was a big part of it. They had 80,000 applicants that year.
Wow.
So it was pretty amazing to be selected, and it was an incredible experience.
So how'd you go in it?
What's that?
How'd you go? Yeah, like when the.
So I got to the second obstacle, which was okay.
Yeah.
It wasn't great, but I was just happy to be there. And I always tell the story that I had this plan. It was the log drop, for those of you that are listening that are familiar with that. So I had this plan to kind of pull up my pants, pull up my shirt, because you want to have skin contact.
Yeah.
But totally forgot that part. So I got up there and my legs, I had longer pants on, so my legs slid off first.
See, I've been telling everyone, I'm going to be doing this podcast quite soon, and I've been telling everyone you came second.
Oh, that I came in second.
That you came in second. You didn't win the show, but you came in second. So that's the story I've been going with.
Yeah, so that's, a small white lie.
Well, I was close. You crashed and burnt on the second obstacle.
The second obstacle, right?
So second is, I'm right, you came second. I just leave out the second obstacle. So,
right, and I like the crashed and burned part. I like that part.
You like that? So, but you were saying, 80,000 people applied, and what did they bring that number down to?
So there's 125 roughly per city, and there's 5 cities. So I was in Philadelphia.
That is still pretty, but just to get on the show though, and even to have the confidence to be able to, like, I know I would never go on one of those shows. I would crash and burn, probably just getting up to the starting block.
Understandable. Understandable.
And even just the nerves, and because I've seen people on these shows, and you see these people super fit, everything's great, and they stumble at the first hurdle.
I know.
And you sit there going, seriously, dude, you crashed there. And some of them, it's purely because of overconfidence. This looked pretty easy. And they try and skip through the first thing, and then their foot touches the water, and they're gone.
Right.
And then you see other people, they're physically just, I don't know, where it was an adrenaline dump, they just lost it when they got there. Then you see the freaks that go through the whole thing, they get to the end, and they haven't even built up a sweat. And you go, my God. It's pretty cool.
It's amazing what everyone can do. It was such an incredible experience. I mean, I didn't compete until 2:30 in the morning.
Oh, okay. So you were tired. That's what happened.
Right. That's what happened.
Yeah.
And I still had my port in my chest, and so it was such for me personally, it wasn't really about American Ninja Warrior. It was that I beat cancer and I trained for it and got to that point. Do
you think if you'd waited another year, you could have done better, or you think you still would have crashed and burnt on that log?
Well, now that you put it like that, I might have done better. Than I did actually apply the next couple of years, but I didn't get selected again.
Oh, bastards.
I think things are, happen for a reason.
Yeah, definitely.
It was perfect timing. I think it's what I needed kind of personally. I felt like after going through all of that, it felt really pretty amazing to be standing there with some of the fittest people in the country.
I think it's incredible. And in addition to that, since then, so that was 4 years ago. 4 years ago?
4 years ago, yep.
Where's your business gone in the last 4 years since then? Yeah, like obviously, yeah. I'm sure the cancer, you were still training during that process. Mm-hmm. But at the same time, it's not that you gave up your business altogether and just stopped doing that. You still built your business as well as the cancer treatment, training for American Ninja Warrior, and then with all your spare time, you still built your business.
Yeah, so actually, a huge thing happened kind of around that time is after American Ninja Warrior, I think the next year I did a TED Talk, and I really started to...
Oh, tell us about the TED Talk, because that was something now that you brought it up, I was going to ask about, because where did you do yours? Because I'm always curious.
So I did that in 2016. So actually, it was the same year of American Ninja Warrior.
Because you had so much spare
And
time. I keep forgetting how much time. Because you actually have 36 hours a day. Just point that out to people.
right.
It's amazing what you've done. So, what was the TED Talk about?
So I did it. It was titled "Challenge Accepted," and it was essentially a little bit about my story, about my mom, my brother, and uh, ultimately how to accept challenges, overcome obstacles through mindset, nutrition, and movement. So that has been really what has driven me my whole career, and definitely through my own personal challenges. So it was a really, once again, personally, it was a very healing time for me. It was really kind of amazing to be able to write things down and talk about it and all the things that had happened, because I think while I was going through treatment, I tend to just kind of power through things.
Yeah.
And I think it was really an important part of my healing journey to actually reflect on everything that's happened.
Yeah, I think that's great. And I also feel like the story you have, and even coming on this podcast and sharing, like opening yourself up and telling people about your life. There might be someone sitting back at home listening to this or driving in their car. Okay, they may not be going through cancer treatment. They may be going through that. But everyone's got their own challenges. And as we're recording this at the moment, we're in the midst of the whole coronavirus, or as Donald Trump likes to call it, the Chinese flu. We had a laugh about that before. Anyway, but there's people they're losing jobs. There's so much negativity in the world at the moment that I think someone listening to your story now can realize, okay, well, I may have lost my job, but I've still got my health.
Right.
Or they may not have the health, but they know, okay, I'm getting treatment for it. There's light at the end of the tunnel.
Right. And that's, a big part of what I'm always sharing with people is to, we have this gift that's been given to us called
Yeah.
life. And I think that we all have to take ownership of our health. We can't just let things happen. We have to really make sure that we're actively working on whether it's our nutrition habits, our physical habits, our mindset and mental emotional state. But I think it's so, so important. And, I think that in a society where most of us are anxious and stressed and depression is on the rise and chronic disease is 50% of the world, even more so, we really have to take control of that.
So you are the founder of the movement paradigm.
Yep.
Can you explain what the movement paradigm is all about?
Yes, I sure can. And so just to back up for a second is, so once I did all of the American Ninja Warrior, the TED Talk, is really when I decided that I was going to open up my own practice. So
because you had so much spare time on your hands now, because you weren't dressing up like a ninja running around the place as well. So you had to do something with all this extra time and energy.
Yep. And that was my original dream, is to open up a multidisciplinary practice. So now I own an integrative health center. So in the center, I have other like-minded professionals, body workers, massage therapists, psychology, personal training, yoga. And then in my business, my goal is really to focus on physical therapy, of course, movement coaching and nutrition coaching through mindset, nutrition, and movement. So really helping people get to the root of their issues, find solutions as opposed to just treating symptoms. And my goal is always to really treat the whole person using a functional medicine approach.
Okay, so I knew functional medicine was going to get mentioned. Explain to people what functional medicine is.
Yeah, so it's essentially a patient or client-centered approach rather than our current conventional model, which is not quite that. It's more of a preventative as opposed to a reactive approach. So a lot of times in conventional medicine, we tend to react to things. So if you have a headache, you're going to take a medication for it, as opposed to figuring out why you have a headache. Did you not eat enough? Did you not drink enough water, etc.? And essentially, it's looking at all the systems and how they work together to really improve someone's health from and utilizing their unique person and body.
Okay, so somebody, for example, has headaches or neck pain or sore shoulders. Normally they go to the doctor or they might go and see a physical therapist, and the doctor and the physical therapist is trying to treat the pain. What you're doing is looking overall that the pain may not just be the pain. There might be
Right.
a lot of other things going on that need to be
Absolutely.
addressed. So it could be their diet, it could be the sleep patterns. There's more to it than just the sore shoulder, the sore neck, or the headache.
Absolutely. Absolutely. And just about everyone in my practice, that's what I see, is that they've come to me and they've either been to multiple professionals or they've had pain for years. They've had the same neck pain, the same back pain. And of course, there can be a chronic pain element, but typically there's always a systemic inflammation that's happening. There's chronic stress, chronic activation of that HPA axis, and there's maybe poor eating habits that are contributing to the inflammatory response, but there's normally multiple things that are affecting that person's pain.
Okay, and especially when you're talking about chronic pain. So somebody says, "Oh, I've had neck pain and headaches for 20 years," but they've never actually had a neck injury. So it's different if someone was going, "Oh, I fell down some steps, and since then I hurt my
Right.
neck." So that could have been an acute injury that was not managed well.
Right.
So it's looking at it from a different way.
Right. And definitely utilizing pain science, but I think that it's even more than just that. So, recognizing that if someone's had pain for 20 years, there is no tissue damage at that point, but their brain is perceiving that there is pain there. But even beyond that, it's figuring out, why is someone having such a hard time managing pain or managing inflammation? And normally it's looking at all of the systems combined, the gut health, the immune system, endocrine system, et cetera, and seeing how those fit together and how it's affecting their condition.
Do you get many people that look at all this, other physical therapists, of what you're doing? And I'm sure there's a divide down the middle. There's some that look at what you're doing and they're going, "Ooh, voodoo. Do I have to bring in my own doll and needles?" And there's other groups that go, "You know what? I think you're onto something, because we're trying to do it the traditional way, treating people, and we're not getting results."
Right. I think more people think the latter. I've been speaking at a lot of conferences and, really I've really been sharing this perspective for a long time.
Yeah.
And sometimes it's, more well received than others with professionals. But I think that the more patients I see that come to me that say a physical therapy didn't work, then to me that is a representation on our profession, which really looks bad. That either as a therapist, someone didn't communicate well enough that it isn't just about just do this exercise and it's going to work or it's not going to work. Really, it's about having someone, once again, take ownership of their health and take responsibility for their role in their treatment as well.
Yeah.
So I would say, if any of my patients ever say that, I'm going to be heartbroken.
So you must get a lot of patients, like you said, that have been to a lot of other places before, and by the time they get to you, you are like a last resort. Yeah, they've been to other physical therapists. They've been massaged and touched, and the person's pulled out the ultrasound machine, and by the time they get to you, they're probably more open to try. To use the word alternative is probably incorrect. Just to try looking at it from a different angle.
Right. Just, I always say, like, as my business is called, the movement paradigm, just a new paradigm, right? Just like a new perspective on things, and how I try to help people understand what I think the biggest things that are affecting them are. So, for example, as you mentioned earlier, I had a patient today who he's experiencing pain. He has some mental, emotional issues. He has some gut issues. And so, what I did was kind of laid out, like, what's the elephant in the room? Like, where do we start with all of these things? And to him, his wrist pain was the biggest thing. So of course I gave him an exercise to address the wrist pain, which was more of a neurological issue.
Yeah.
So of course I did that, but then he wasn't sleeping. He's on night shift, so he was hardly sleeping at all. He would go 2 days without sleeping and then sleep. So of course, I could give him all the suggestions in the world, but if he's not getting an appropriate amount of sleep, he's never going to feel good. He's never going to be able to get rid of pain. So it's kind of just navigating that path of, what's most important at that time for that person.
Okay. And the sleep is so important because when your body is just at rest and it's healing itself, you're not using it. So if you're not sleeping enough and you're constantly pushing your body, it's going to have a negative effect.
Absolutely. Absolutely. I always say it's more important than nutrition and fitness combined.
Oh, right. Okay. Sleep's that important.
I think it's that important. And not everyone will agree with that. I just think that it's that important because it's really hard to make the proper food choices if you're exhausted. For example, it's hard to exercise if you're exhausted. So it really should be such a huge priority for people. And I think it's so overlooked. And it's not necessarily just about the quantity, it's about the quality of sleep. Not watching blue light before you go to bed and, using stimulating activities or anxiety provoking activities before bed.
Okay. And when you mean blue light, that's like having your phone, your computer, looking at that just before you go to sleep.
Right.
Does not help you go to sleep.
Correct.
Damn it.
Drinking before bed.
Oh my God.
That's the worst for quality of sleep.
Okay, so the negatives are, like, if you really want to ruin your sleep, is alcohol.
Alcohol for sure.
Phone and computers and just watching TV just before you go to sleep. And unfortunately, a lot of people would do that. They would watch a bit of TV or they might be checking things on their phone. They're having a glass of wine.
Yep.
They do all this before... Yeah, and then they have a snack before they go to sleep. So they're doing all the wrong things. And especially busy people, they tend to work long hours, get home late, eat later, have a few drinks, then sit on their computer, and then they eventually decide to go to bed. So they're doing all the wrong things.
All the wrong things, right. And
then they wonder why they wake up the next day and they go, oh, I've had my... Because I don't sleep that much anyway. Usually I sleep about 5 hours, 5 or 6 hours. And I usually still have a lot of energy. But I think I could have more if I stopped doing all the things we just made. I'm talking about, all those other people, they do that, not me. But that was me last night. Which I mentioned when I got on here, when we were first starting to talk, that I said I had 1 or 2 drinks too many.
You did say that.
Yeah. And I'm feeling good now. I'm feeling better now that I'm talking to you. So this is it's like a consultation now. I'm starting to feel guilty. So where can people learn more about this? The movement paradigm. Do you have a program or something that people can actually learn more?
Yeah. So, my website, I have all of my services listed. I do virtual appointments as well as in person, if anyone is nearby. But I also have an online program that I offer several times a year. So that is also listed on my website. And on my social media handles, I do weekly videos. My YouTube channel is Arianne Missimer. And I have Facebook and Instagram, and those are at the Movement Paradigm.
Okay, so I'll have all those details in the show notes. So the website is the Movement Paradigm?
Yep, themovementparadigm.com. Mm-hmm.
Okay, that's nice and easy. So before we wrap up, have you got somebody's listening to this now, and other than the tip that you just gave about stop eating, drinking, and getting on your phone just before going to bed, which is going to help with sleep, are there any other couple of tips that someone's listening to this now and they're going, yeah, I need to improve a few things? There's a couple of simple things that I can do immediately.
Of course, yeah. So I think from a stress standpoint, because this is a especially stressful time, and even if it's not right now, I think this is something that everyone deals with, is really just taking 3 diaphragmatic breaths every hour. So breathing in through your nose and out through your nose if you can. And maybe 4 seconds in, 4 seconds out is a good starting point. And the longer the exhale, the better. That allows you to tune into your body on a regular basis to be able to check in, see how you're feeling, become more present, and it also relaxes your nervous system.
So is this every hour you're saying that you should do this?
Yep, I would say every hour.
I did hear someone once saying about that, and they actually put a reminder. They have like an alarm on their phone that goes off every hour to actually tell them to do these breathing exercises.
Yep. I always say breathing is your superpower for so many reasons. And then the second thing as it relates to nutrition is most people are typically getting anywhere from 2 to 3 vegetables a day, if that. So I always say just a really basic thing is just to include 1 more vegetable a day than you're already currently eating. And then use that as a baseline to continue to improve that, because that can really help naturally eliminate some other foods, maybe more inflammatory foods, and it can also help with becoming a little more pro-inflammatory.
Okay, well, just speaking on the dietary side of things, is there are there foods that people should reduce or eliminate that's going to make their mindset better, sleep better, other than alcohol? Because if you tell people stop drinking, they're going to go, I knew this was all voodoo.
I'm not going to do that. So I won't go through all the 12 potentially inflammatory foods, but there are 3 that are really something that I would explore in your diet, which is gluten, dairy, and sugar. And I always say that it's important to see how those foods would affect you. So to do an elimination of those foods, dairy, you can eliminate completely for 2 weeks, and then you could do a reintroduction. You would have it twice in one day, and you would see what your reaction is. So you would kind of write a little journal. Do you have any pain? Do you have any digestive issues? Do you have any headache, fatigue, anything that comes up? And you would wait those 4 days, not have it again, wait those 4 days and track it every day.
Yeah.
And then with gluten, you would have to do it a little longer. So roughly 3 to 4 weeks, you would keep it out of your diet. But we don't know if it is an inflammatory food until you try it.
That's interesting. So you're not saying, you must stop dairy. Like some people will say, you have to stop dairy because that's bad for you. It causes inflammation. It may not cause inflammation. It may cause inflammation in one person, but for you, it may not.
Right. And that's how I present it to every patient is just let's explore this together and see how it affects you. I will say that many people have a negative, reintroduction, meaning they have some kind of symptom.
Yeah.
However, that allows them to really gain that knowledge and perspective. And so then they can make a conscious decision going forward, whether or not they want to include that in their diet.
That is a cool approach. I like that approach because I've been to places where they say, Tyson, you must stop this, and they give me a big list of all the things I can't eat.
Right.
And you go, okay, so what you're doing, you're taking away all my fun. And I do, like, I eat pretty well, but I've never heard anyone say, let's do a trial, go off of it for a certain period and then reintroduce it, see what effect it has. It's almost like you must either stop completely or just keep doing what you're doing. There's never been any middle ground. So I think that's really good advice.
Good. And then I would say the last, from a movement perspective, I always say to find something that you love. But with that, make sure that you're moving with purpose and intention, and you're really taking the time to build your body up as opposed to break it down. A lot of times I think we tend to get into fitness programs where you're just kind of pushing harder, and you are breaking your body down and having pain and compensation and potentially injuries, as opposed to just taking the time to move well. As Greg Cook will say, move well and then move often.
Okay, yeah. I could see, and that's when people all of a sudden they decide, I'm going to get fitter, I'm going to get healthier. So they take up running. Mm-hmm. And they might walk majority of it and then run a couple of 100 meters. Next thing they're doing 5 kilometers, then they're doing 10 kilometers. And then every run they do is 15 kilometers. And then they're doing like a half marathon every weekend because they can. Mm-hmm. And then it's just one injury after another injury. But they're going, but I'm doing all this running. It's supposed to be good for me. Right. And I think I've done the same thing with Muay Thai. And where I was going a couple of times a week, and then all of a sudden I'm going 5-6 times a week, and was getting injured, but I'd still go 5 or 6 times a week. I wouldn't let that injury stop me, and that would just lead on to more. And even though I'm feeling fitter and stronger, and I'm like a lethal weapon now, but I'm like a lethal weapon that's limping around most of the time.
Yeah. And I think that's what happens all the time. I always say just because you can doesn't mean you should.
Geez, that's good advice.
Really just, like I said, moving with intention, with purpose, taking the time to know when, for example, you should not work out that day and when you should push it. I measure heart rate variability, and I encourage my patients to do that as well. So knowing if their nervous system is actually recovered or if they're still in a stressed or poorly recovered state. If they push it, that's when injuries can happen. And they're not getting any benefit to their exercise program.
And I think at the moment too, what's really interesting with the whole coronavirus and where we live now at the moment, all gyms, all indoor sporting places have all been closed down. So this is a total shift for everybody. Absolutely. People who have been going to the gyms 5 or 6 times a week and flogging themselves senseless have now got to come up with alternatives. Well, we were going to kickboxing 5 times a week. We have to start changing things. So this is a good opportunity for people to start trying different types of activity, whether you might do a little bit on a punching bag, you may go for a walk, you may do a little bit of running, yoga, testing the waters on different things and seeing how your body reacts to it. Mm-hmm. Always got to look for positives when all the shit goes down.
I know. It's going to make us stronger in the end.
I said to somebody recently, with everything that's going on at the moment, this is the world reset we had to have. And what I meant by it was, I'd overhear my daughter saying, my daughter's 15. So she's wants to meet with her friends before school to have a coffee. And I'm like, since when did 15-year-old kids meet before school for a bloody coffee? Or they're talking about, I've only got an iPhone 8. Thingo has an iPhone 11. So she's been saving her money up to buy an iPhone 11. Mm-hmm. But she turned around to me the other day when all this started, and she said, do you think I should still buy that iPhone 11? I said, well, look at it this way. You got a part-time job. If you lose that job tomorrow, is taking all your money that you've saved up to buy the iPhone 11, is it really that important? And she went, no, I can stick with the phone that I've got. And that's what made me think maybe this is the reset we need to have. We've all been overindulging in so many areas of our life, right, that this might be the thing that even though I know this, it's not good, but maybe that'll be the positive that comes out of it in the end.
Absolutely. Yep. I hope so.
There's got to be some positives. There has to be.
There is. There will be.
So Arianne, I want to thank you so much for coming on It's No Secret with Dr. T. This has been an enjoyable conversation, as I knew it would. And I think you would have inspired a few people to get off the bum, stop whinging and having a sook about certain things in their life. And there's other people. I always say, no matter what you're going through, there's someone going through it a lot worse. So just be happy with where you are and just move on from there. So thank you very much.
Thank you so much. It was great chatting with you.
Well, I hope you enjoyed listening to Arianne as much as I did having the conversation with her. And talk about inspiring, to go what she went through with cancer, but at the same time to have the mindset to want to train for American Ninja Warrior, I think is amazing. And all the other advice she gave us about foods, exercise, and activity, you had to have taken something away from this episode. And if you've been enjoying this particular podcast, It's No Secret with Dr. T, please tell friends, family, work colleagues that it exists. And if you get the urge, please leave us a review on iTunes or wherever you listen to your podcast. So that's it for me this week. Look after yourself, look after your family, and I will talk to you again very soon. And in the spirit of sharing, here's a couple of other podcasts that I enjoy listening to.
I did not grow up with very much money.
Money's energy.
Money is something that really scares me.
You had about 60 grand in debt.
Money isn't the answer.
Somebody should just give me a lot of money.
My dream was to be the WWE wrestler, but you realize that your dreams change over the years.
Money is a tool. It's a key to a gate. And at the other side of the gate is the things that you really want to do with your life. It's the things that matter most to you. It's pursuing those values that make you ultimately happy.
Listen to Inspired Money at inspiredmoney.fm.
My name is Eric Hunley, and I host Unstructured,
On Unstructured, I have intimate conversation with a diverse range of people. I've interviewed a presidential candidate and a felon. Not the same person. I've even chatted with a musher. Yep, a sledder behind a pack of dogs. And in these conversations, we learn what drives these folks. Please, come check out Unstructured. You can find Unstructured wherever you listen to podcasts.